So push this to advance.
Yes.
Okay, that's great. Thank you very much. Chairman, ladies and gentlemen, thank you for allowing me to tell you about our shiny new group, the Ireland-Africa Alliance for Non-Communicable Diseases. But first, just a few words about non-communicable diseases. You see these in red at the top of the slide, and it's thought that there are two essential causes of these. On the right, you will see that over the course of human history, we've adapted, because of chronic undernutrition, which is really the course of human history, by becoming very efficient at storing and utilizing energy. And that's all fine and dandy if we were in a state of undernutrition. But as you know, in the second half of the 20th century, we changed our lifestyle patterns with regards to diet and exercise, and we're still storing. So that's led to obesity, the metabolic syndrome, which feeds through to these non-communicable diseases. Their importance are that they are lifelong, they are not transmitted from person to person, they're long duration, slow progression, and they are invisible to begin with, but then become progressive with onset of complications, disability, and death. The World Health Organization says that they are the leading cause of diseases leading cause of death and mortality in the world. It is an invisible epidemic and is underappreciated cause of poverty and hinders the economic development of many countries. The figures on the left show, while we know that acute diseases, tragic situation, kill hundreds of thousands of people, the WHO says that of 55 million deaths in 2019, 41 million were due to non-communicable diseases, and most of these are premature deaths under the age of 70. The other figure in the box on the right shows that 80% of non-communicable diseases are preventable by modifying the risk factors that we mentioned that cause them. The Alliance has its foundation really in two infrastructural projects in Africa, one in East Africa in Malawi, and one in West Africa in Togo. The Malawi Health Partnership is a partnership between the PALM's GP practice in Gori and the Mzuzu province in Malawi. And it has a number of projects that are running, including hypertension projects, diabetes education, asthma, and screening for rheumatic heart disease in the schools. And this has been very successful. The Togolese project is a personal project of mine that started about 13 years ago, and I've been to Togo about 18 times since, in my own time, at my own expense, and seemed to be going nowhere, but gradually I formed friendships and partnerships and trusting relationships with the stakeholders in Togo, which culminated about 6 years ago with the head of the NCD department of the Ministry for Health in Togo, my friend Professor Bello, taking me to this disused, and you see it along the top there, this disused, overgrown, uninhabited building, and said, this is in the grounds of a hospital, he said, this is going to be the new NCD center. And you are the patron, which means there's no money, I have to raise it. So I looked at him as though he had two heads, and scurried back to Ireland and spent the next year, and we managed to raise enough funds through small donations to renovate the centre, and you see that in the middle row there. And I'm very glad to say that it opened in February this year. David Wheatland was present at the opening, and it's probably the first NCD centre in Africa. Certainly a public one anyway. Now, if you think that these two little projects are going to make any particular impact, I'll just put you straight, because if you look at the natural history of type 2 diabetes as a prototype NCD, you'll see that from the left there, that the genetic susceptibility we talked about, followed on by the interaction with the risk factors, causing the progression through pre-diabetes, diabetes, and as you move rightwards to complications, disability, and death. And you can intervene at all of these points along the way. Primary prevention at the left, clearly requires public education. It requires money spent by the government and legislation, food legislation, etc., etc., etc. To the right of the diabetic line, you can intervene at those places, but it requires a coherent, functioning medical service and universal health coverage, none of which these countries have. So as you move along this, on the right, on this highway to hell, you'll see that it gets more expensive to treat them. So, we're nearly finished, David. During COVID, not much happened, and after discussion with my friend Michael O'Toole, we wrote to 15 or 16 really eminent people with an interest in non-communicable diseases in Ireland, and we have formed this alliance. We meet monthly for the last 2 to 3 years, and it's actually humbling to see people spend so much time on a voluntary basis to be giving their time to this cause and project. The activities and achievements really are, I'll skip most of this. We have, fortunately, a great alliance with ESTHER. We've established partnerships both in Togo and Malawi. We've landed a ESTHER Band 1 grant for an MOU with the Togolese Ministry of Health, and a Band 2, and 2 of our senior nurses have already been out to Togo and conducted a course with the tutors and all the tutors in the Togolese National School of Nursing. And we have an Erasmus grant ready to land in November, and I'm very proud to say that we've actually just established an advocacy subgroup under the chairmanship of Tony McPoland, who's the ex-CEO of Deutsche Bank Ireland. I won't go through all these. The difficulties and challenges basically are, of course, funding, they always are, the time commitment of professionals here in Africa, and what we find very difficult is the allocation of funds in communicable diseases versus our particular interest in non-communicable diseases, even though the latter is so much more important. It's not terribly sexy, it's not acute, it doesn't really compare with cancer, with Médecins Sans Frontières, with war zones, etc., but it causes its huge amount, own particular share of human suffering. And I'm not going to go through this, but special thanks to many people. Thank you very much indeed.